CDC says Florida Surgeon General draws wrong conclusions from COVID data in his vaccine warning. CDC says Florida Surgeon General draws wrong conclusions from COVID data in his vaccine warning. You're listening to World Reading Club, presented by Hakeem Alibokis Alexander on Spreaker. Social podcasting, presented for World Reading Club in association with Uniquilibrium. This edition's reading focus comes to us from South Florida Sun Sentinel. It was published on February 17th, 2023 at 1:22 p.m. by Cindy Kirscher Goodman and Caroline Catherman. It is titled, CDC says Florida Surgeon General draws wrong conclusions from COVID data in his vaccine warning. People who received a mNRA COVID vaccine, it should be mRNA COVID vaccine, which is spelled differently on the Sun Sentinel website. Let's start that again. People who received an mRNA COVID vaccine reported a high number of adverse reactions into a government database, but the Centers for Disease Control and Prevention said Florida's Surgeon General is drawing incorrect conclusions from the data. Surgeon General Joseph Ladapo, who oversees the Florida Department of Health, sent out an alert Thursday to health providers and an email to federal health agencies to warn that mRNA COVID vaccines could be dangerous. He has been vocal about his opposition to the vaccines since taking his position at the helm of the health department. The alert Thursday said the reporting of life-threatening conditions into federal government's Vaccine Adverse Event Reporting System, VAERS, from Floridians increased over 4,400% after the release of the COVID-19 vaccine. He also noted the overall increase in adverse event reports after the release of the COVID-19 vaccine compared to other mass vaccinations. CDC spokesperson Nick Spinelli said Ladapo's data is misleading and needs context. Anyone, healthcare professionals, manufacturers, general public, can send a report of adverse events into VAERS after vaccination. Some of those adverse events may be true adverse reactions, or they may be coincidental events and not related to vaccination. VAERS is not designed to determine if the vaccine caused the reported adverse event, Spinelli said in response to questions from the South Florida Sun Sentinel. He cited 4 additional reasons why Ladapo should not be using VAERS data to make conclusions about the COVID-19 vaccine. Point. Mandates. The reporting requirements to VAERS are more stringent for COVID-19 vaccines than for all other vaccines. Point. Volume. More than 670 million doses of COVID-19 vaccine have been administered in the United States. This accounts for more doses of COVID-19 being given than other vaccines. Point. Cause and effect. The CDC and FDA encourage the public to report adverse events to VAERS regardless of whether it is known if the vaccine is the cause. Awareness. VAERS has received wide media attention, which likely leads to increased reporting rates. William Schaffner, an infectious disease expert at Vanderbilt University Medical Center in Tennessee, agreed with the CDC that it is not scientific to use adverse events reporting to draw conclusions. We don't know for certain that the vaccine has caused the reaction, and that is the great hole in the Florida Surgeon General has fallen into, he said. Schaffner said CDC investigators do deeper research when they see something troubling in the data, and Ladapo has not done that causal research. One way you cannot draw conclusions is to just look at adverse reported events, Schaffner said. Academic researchers throughout our country and around the globe have seen troubling safety signals of adverse events surrounding this vaccine, Ladapo wrote in his Department of Health warning, citing 3 research studies. 2 of those studies address cardiac events following mRNA COVID-19 vaccination. Restaf Levi, a business professor at MIT, co-authored one of the studies Ladapo cited in his assertion that COVID-19 mRNA vaccines are causing serious harm, including death. I believe that Dr. Ladapo's health alert is more than warranted, he said in a written response to questions from the Orlando Sentinel, adding that the paper he wrote finds a major and statistically significant increase of 25% in the number of EMS calls with cardiac arrest diagnosis among people at ages 16 to 39 in 2021 compared to the previous years. Yet he adds this caveat. Indeed, as the paper clearly states, merely this study does not provide a proof of causal relationship with the vaccines and only shows a concerning signal of association. The CDC also doubled down on the safety of the bivalent vaccines and its recommendation that people stay up to date with COVID-19 vaccines. COVID-19 vaccines have undergone and continue to undergo the most intense vaccine safety monitoring in U.S. history, Spinelli said. Last fall, Ladapo warned young men and children against the COVID-19 vaccine. His peers have accused him of relying on flawed analysis to determine the risk to that age group. As far back as December 2021, Ladapo ran a public service announcement that touted innovative solutions for COVID-19, including treatments with little track record, rather than encouraging vaccination. Sun Sentinel health reporter Cindy Goodman can be reached at cgoodmantinel.com. That's cgoodman@sunsentinel.com. You've been listening to World Reading Club, presented by Hakeem Alibokis Alexander. Presented by Hakeem Alibokis Alexander on Spreaker, social podcasting. Presented for World Reading Club in association with Uniquilibrium. This edition's reading focus comes to us from sunsentinel.com. It's titled, CDC says Florida Surgeon General draws wrong conclusions from COVID data in his vaccine warning. It was published on February 17, 2023 at 1:22 p.m. by Cindy Kirshner Goodman and Caroline Catherman. You can read this article and others like it for yourself by visiting sunsentinel.com. That's sunsentinel.com. sunsentinel.com. CDC says Florida Surgeon General draws wrong conclusions from COVID data in his vaccine warning.